to ask for your both permission to use this video for educational purpose and on internet. Okay, now for how long did you have spine problem before our surgery?
6 or 7 years.
So how bad was the pain before our surgery? 1 to 10?
Yeah, it was in that 9 and 10 range.
9 and 10 range, yeah.
It wasn't good.
And your spine was twisting, was bending the wrong way, pushing on the nerve. And I'm just going to turn around and show you what we did. We did a L1 to L5 fusion. This surgery, we put interbody spaces everywhere, and all the screws are good. The fusion actually is starting to take inside the bone, and in the back, even in some areas, the bone is starting to grow. And here's the record of the surgery. You stayed just after this big surgery, just one night in the hospital. Surgery took us 1 hour and 21 minutes, and our blood loss was 86 cc, which is 2.5 ounces, which is really nothing for this kind of surgery. Now, I understand right after the surgery, the pain was bad the same day.
It was, yeah.
And we totally understand that because we don't cook the tissue. Like after open surgery, sometimes we cook the tissue to stop the bleeding, but we keep the tissue alive. And sometimes a live tissue can complain, but vast majority of my patient next day pain get better.
Yeah.
How was yours?
Yeah, it got better the next day.
Next day.
Yeah. I was able to walk with a walker or stuff. And go up and down stairs and camp.
And what I think was unimaginable after open old-fashioned surgery, that after 4-level fusion, you went home next day. Is that right?
Yeah.
So you did feel like going home and you could take care of your basic needs and pain was controlled?
Oh, yeah.
Yeah, but how are you now? We are just 6 months after the surgery. How are you now?
I'm pretty good. I'm good. I'm walking better. I don't use the cane as much.
Yeah.
And I try not to use the cane.
Yeah.
Walk slower, but
you told
I don't
me
have much. I don't have near the discomfort that I had before.
You told me the pain is now 3 of 10, which it was 9 and 10 before.
Yeah.
But recently you felt like, and that makes me happy that you feel like that, but that can be difficult. You told me that the pain got worse after some activity. What did you do to make the pain worse?
What happened last week?
Oh, I had to shovel snow, yeah.
But you felt like that, whereas I just in this room before you, I had a lady here.
Yeah.
It took her 6 months to do basic activities, like literally being able to take care of herself. But you felt like shoveling snow. And the difference is that she got only one of the level fused, not 4 levels. So your surgery is 4 times bigger than hers.
Yeah.
And it took her after open old-fashioned surgery 6 months to just be able to do basic activities. So I'm very happy. And overall, I am very happy with where we are just 6 months after this very big surgery. Are you overall happy with this result in your spine?
Oh, yeah.
What is your observation?
Oh, the thing that I notice the most is how fast, relatively fast, because it used to be that he would just be at, I could be 2 blocks ahead of him.
So he can walk better and faster.
And now he can walk better and faster. Yeah.
And I cannot overemphasize how important it is for our body for us to be ambulating. Meaning that our body is made to walk, and if we don't walk, we are deconditioning our heart and lung, and
I was only able to walk about 15-20 steps.
Yeah, before
and then
you
I
have to
have to stop and let things settle down, and then I could go a little bit again.
So, and this is called claudication. We corrected that claudication before the bone and the material of the disc were pushing on the nerve. We were able to overcome that by restoring your spine without cutting the bone, without destabilizing your bone, and without putting you on a track of 1 year healing, because we didn't have to cause too much damage. You could recover much faster. If you don't walk, our heart and lung and so on they shut down literally.
Yeah.
Okay, so that's important, very important factor. Any other observation? Anything else?
The only other thing, to bring up is that he was on pain medication,
Yeah.
like the heavy duty oxycodone
Yeah, I know,
and
I
then
know.
hydrocodone.
And he had a real problem.
Absolutely, absolutely. But he was able to wean off that, I thought, fairly quickly.
Once we corrected the problem,
Yeah.
now you could reduce it efficiently and successfully.
Yeah, no,
And-
I'm essentially off that stuff, so,
Yeah, excellent. Well,
And see, and that's a good point that you brought up, is that he had been on those heavy-duty ones before, prescribed by his GP.
yeah.
And then with the opioid situation,
Yeah.
they said, no more. And that
And he was
is
miserable.
when it really, he was
Yeah.
in such pain.
And I think that is a little bit of a madness, for us to be so afraid of treating patients, so we let them to be in pain. And that is unhuman sometimes. But overall, we are going the right direction. We fixed the problem, so you don't need that much narcotic. And the narcotic can destroy your body. We know
Yeah.
that.
Yeah.
But open old-fashioned surgery, 4 levels for you would have been too much.
Oh,
But now we're able to do that surgery with one surgery that was 1 hour and 20 minutes, with 2.5 ounces of blood loss, 1 night hospital stay, and you are on the path to again regain your life.